Tuberculosis remains on record as the world's deadliest infectious killer, having surpassed HIV as the leading cause of death among infectious diseases. 1.25 million deaths were recorded in the year 2023.
For Africa, we still have quite a number of challenges in terms of getting a good headway in overcoming TB. Like, TB has been 1824, and it's been here. Now, some of the African countries, for instance, are among the top 10, that has a high burden in TB. The challenges, look at the diagnosis. We still have quite a number of challenges with diagnosis. That we have challenges also in children. Children, some difficulties in diagnosing them with tuberculosis. Then aside that, when it comes to funding tuberculosis program or treatment or management generally, it requires a lot of funds. And so we need that commitment from, the government, civil societies, local agencies, even philanthropies in the community. We could make it a communal, like a domestic resource mobilization models, to be able to fund one or two aspects of tuberculosis.
Adekunle says while TB continues to be a major public health challenge globally, it is important to note it is a curable and preventable disease.
Tuberculosis, is airborne, and we have to work together as a community. The management is going to be communal. That is, everybody needs to care for each other. So, for instance, when you see somebody that has the symptoms and signs, the next thing is not to stigmatize. The next thing is to make sure the person gets care.
He also touched on the success on the continent in addressing TB.
However, we are making quite considerable strides, in terms of getting more treatment coverage, that is to getting more people, for increasing access, to care. Access is also a big challenge. So increasing access to care, for those that have affected and in the communities. And also we're trying now to, those that are diagnosed, making sure that they get enrolled on treatment, So these enrollment gaps, access gaps are being closed in our countries in Africa.
A conference such as this, he says, offers hope as it seeks to identify innovation by researchers and healthcare professionals from high-burden countries in Africa and commitment from key international organizations, the private sector, civil society, researchers and implementers. The conference will discuss the clinical translation of recent developments in the context of regional epidemic patterns and healthcare systems and share real-world experiences, facilitating evidence-based implementation of programs. It also means to foster new and lasting cross-disciplinary collaborations to strengthen TB research and management in high disease burden regions, as well as encourage and support early career investigators in their trajectory towards becoming future leaders in TB research.